In the past 2 weeks, the number of cases of COVID-19 outside China has increased 13-fold.
In early 2020, the World Health Organization declared the outbreak of the new coronavirus, COVID-19, a global pandemic. In the Southern African Development Community SADC, member states sprang into action to protect millions of citizens by instituting steps to regulate the movement of people within and across borders and by establishing quarantine facilities for infected people. By any account, those first few months of the COVID-19 pandemic were tough on SADC and its people. The number of lives saved by these measures is incalculable, and as the region, along with the rest of the world, waited anxiously for the development of vaccines with which to combat the novel coronavirus, the leadership and the people of SADC bravely soldiered on in the face of the pandemic. And then a vaccine was developed, and then another, and then several more. At last, there appeared to be light at the end of the tunnel. But the perennial issue of the cost of vaccines arose once more, and people wondered if African countries would be able to supply citizens with the COVID-19 vaccines either for free or at minimal cost. Thanks to several initiatives by SADC and the interventions of individual governments and efforts by a coalition of global campaigners, vaccines started flowing into SADC. There are several success stories related to this period in the recent history of SADC. Among them is how small island nation states like Mauritius and Seychelles were able to quickly secure vaccines for virtually the entirety of their adult populations. Another major highlight was how President Emmerson Mnangagwa of the Republic of Zimbabwe, who in August 2024 takes over as the chairperson of SADC, instituted one of the world's best vaccination programs. In a nationwide program that was lauded by the United Nations and other heads of state and health campaigners globally, President Mnangagwa's government imported millions of doses of the COVID-19 vaccines for free distribution to the public. Not only that, Zimbabwe also donated vaccines to fellow SADC member state, the sister Republic of Namibia. For the incoming chairperson of the Southern African Development Community, President Emmerson Mnangagwa, the good health of every single citizen of the region is an absolute right.